Prasanjit is available?
Prasenjit sir is attending an emergency, sir. He'll be available soon, sir. I'll start the
You please start.
audit, sir.
Any other VICs are
Okay.
present?
Okay.
No, nobody else. Okay, you start
No.
with the audit.
Yes, sir.
Mehul, please start.
Hello, everyone. Hello, sir. Hello.
Am I audible?
Yes, sir, you are audible. Am I audible to you all?
Yeah.
Okay. Very good morning, sir.
Good morning.
And I'm Sylvia from Clarinet, and welcome to you, all of you in this today's session.
Okay. Sir, I'm starting the presentation.
Yeah, please.
Total number of elective.
Please share your
elective
screen.
OT days.
I'm unable to see your screen.
Oh, अच्छा. Total elective admissions 60. Total emergency admissions 25. Total elective operations 54. Total emergency operations 18. Total minor operations done were 19. One mortality.
Mehul, unable to
Surgeries 6 was done for.
Hello.
Yes, sir. 1 second, sir.
Yeah. Please proceed.
In hernia and groin surgeries, 1 hernioplasty was done for unilateral inguinal hernia. 14 herniorrhaphies were done for unilateral inguinal hernia. 1 TAP was done for ventral hernia. 2 anatomical repairs were done for umbilical hernia. 1 TAP was done for umbilical hernia. 2 herniotomies were done for congenital hernia. 4 Jaboulais procedures were done for hydrocele, and 3 circumcision were done for phimosis. 1 breast excision was done for unilateral breast fibroadenoma. In emergency operations, for a case of perforative peritonitis, exploratory laparotomy with primary repair was done. Two debridement were done for foot ulcers. 1 IND was done for gluteal abscess. 2 ID was done for perineal abscess, and 1 ID done for supraclavicular abscess. Acute gallstone pancreatitis, 2 such cases were managed conservatively. Acute calculus cholecystitis, 3 such cases were managed conservatively. 2 appendectomy was done for acute appendicitis. 1 exploration of scrotum and detorsion was done for a case of partial torsion. 2 cases of subacute intestinal obstruction were managed conservatively. For a case of foot cellulitis with compartment syndrome, fasciotomy was done. 6 cases of diabetic foot ulcers were debrided and dressing was done. And for a case of chronic leg swelling, exploration and ID was done. In minor operations, 8 sebaceous cyst excision, 2 lipoma excision, 2 granuloma excision, granuloma,
You can
3
skip this slide.
excision of dermoid, 1 chest incision, 1 mortality which was male. A 68 years old male was admitted for elective hernia raphe of right inguinal hernia who was hypertensive, and pre-operative ECG showed sinus bradycardia. On a POD1 was uneventful with stable vitals. On POD2, the patient complained of chest tightness and difficulty in breathing. TROP-T was done, which came out to be positive. Then the patient was shifted to the CCU and stabilized. On POD3, further tests were done. NT-proBNP was 1200 nanogram per deciliter. CTNI was also raised. He was on NORAD support of 3 ml per hour and high flow nasal oxygen of 45 liters per minute to maintain hypertension and saturation. On POD4, the patient was intubated, and later in the evening, the patient developed sudden cardiorespiratory arrest and succumbed to death. Thank you, sir.
You have mentioned a chronic leg wound in one of the emergency.
Yes, sir. Chronic.
For which you have done an IMD.
Yes, sir. Actually, sir, that was a child. Yes, I am telling you, sir. The child had a history of trauma, RTA, 2 months back. From then, he had that chronic swelling.
Unable to hear.
Actually, sir.
Sir, your voice is breaking actually. I think network issues.
I'm audible now.
Hello?
Am I audible now?
Yes, now you are audible, but before that your voice was breaking.
That's a exploration was done. It was a loculated fat swelling, loculated swelling with fat and
Yeah, why 2 months old leg injury? Why did you plan to intend to do an IND? Actually, it is not an IND. I think you did a fasciotomy.
So it was a very small swelling, sir. The incisions we do in fasciotomy, sir, that it weren't required. So it was a very small loculated swelling which wasn't resolving with antibiotics. So exploration was done and ID was done. After that, antibiotics were given and it has resolved.
So
now.
was there any pus?
It was pus mixed with fat, sir.
Okay. Okay. Probably an antibiotic then.
Yes, sir.
Okay. Okay. And the total number of cases that is a bit wrong. In the yesterday I attended the meeting and they are showing 62 cases from your unit and you are showing 54 cases.
So 62, sir. So I counted from the. So I counted from the OT list, sir. The list in the OT.
Okay, okay. Okay, Diptaman, please start.
Okay, sir. So 1 second, sir.
Hello, am I audible?
Yes,
Yes,
yes.
Good morning, everybody. I am Dr. Diptaman Ravi. I am going to present the surgical audit for March 2023 of Unit 6 General Surgery. Next slide, please. Total OPD days were 9. Total admission days 10. Total OPD patients 1011. New patient 747. Old patient 289. Next slide. Next slide, please.
Next slide.
Next slide.
I think Mehul is having some connectivity issues.
One second, sir. Is it visible now?
Yeah, yeah.
Yes, yes. Okay, elective admission was 45, including male 22 and female 23. Emergency admissions 19, including 11 male and female 8. Elective operation 37. Emergency operation 7. Minor operations 38. There was no mortality, but 2 morbidity cases. Now some detailing regarding elective admissions and OTs. In hepatobiliary and pancreatic splenic surgery section, chronic calculus cholecystitis cases were 13, which underwent lap cholecystectomy. There was a case of GB mass, which underwent palliative cholecystectomy and choledochoduodenostomy. And there was a case of choledocolithiasis, which underwent choledocolithotomy plus cholecystectomy plus choledochoduodenostomy. In the gastrointestinal and perianal sections, chronic appendicitis cases were 2, underwent one open appendicectomy and 1 lap appendicectomy. Fistula cases was 2, underwent fistulectomy operation. There was a case of anal fissure, which underwent internal sphincterotomy. Next slide, please. In thyroid and other miscellaneous sections, there was a case of dermoid cyst behind right ear, which underwent excision. There was a case of bilateral thyroid nodules, which underwent total thyroidectomy. This was done in a sutureless way, including the using the vessel sealer. Then there was the case of oral submucosal cyst in lower lip, which underwent excision. In the emergency operation sections, there was a case of peptic perforation, which underwent laparotomy in our admission day. There were 3 cases of acute appendicitis, which underwent appendicectomy. There was a case of perianal abscess, which was done with IND. There was 1 case of diabetic foot ulcer, which underwent debridement and dressing. And there was a case of severe gangrenous foot, which underwent below knee amputation. Next slide. One side missed. Please come back. Yes. Regarding other emergency admissions, there was another case of peptic perforation, which underwent laparotomy. There were 3 cases of acute cholecystitis, which underwent conservative management. There were
What happened?
Okay, now minor operations. Regarding minor operations and emergency interventions, there were a few cases of 2-cut biopsy, total
Hello.
4.
You can
Am I
skip
audible?
this slide. Yes, audible, you can skip this slide.
Acha. These are all minor cases. Regarding morbidity and mortality, there were no mortality in the month of March in our unit, but 2 cases of morbidity was there. Morbidity number 1, there was a young male who underwent exploratory laparotomy due to peptic perforation. On the POD 1 was more or less uneventful, but on POD 2, abdomen becomes slightly tense, bowel sounds were audible. USG terms was within normal limits. Patient was kept on NCM and IV fluid. Patient was kept on NCM for another 2 days and IV fluid continued, but patient fast started. Then gradually the abdomen becomes soft. There was no history of fever or total count, and total count was also normal. But he developed surgical site infection after 3 days. However, he continued his regular dressing for next 4 days along with antibiotic coverage and other supportive care. After which gradually his wound infection subsided and the patient was subsequently discharged. In morbidity 2, there was a case of cellulitis in leg with uncontrolled diabetes who got admitted in male surgical ward. Debridement and dressing was done in the emergency OT. However, there was continued wound discharge from the next day. on POD1 after consulting with medicine department regarding uncontrolled diabetes, we started giving him regular and long-acting insulin. From
Nityavan,
POD2,
this won't be called a post of morbidity. Diabetic foot will be treated like this only. This won't come under
Okay.
morbidity.
Okay.
Okay.
Then there was no any significant other morbidity cases.
And your slides are a bit disorganized again. For peptic perforation, all the similar routes should come under one heading. Peptic perforation you have mentioned in 2 to 3 places. Okay,
No,
please
no,
look
actually,
into it.
no.
Twice you have mentioned peptic perforation 1, peptic perforation 1.
Yes, this was misprinting.
Okay, that was admission, this is operation. Then the admission should come before operation.
Actually, I mentioned, yes, that could have been done. Actually,
Admission
in
should
emergency,
come before operation. That is the mistake.
yes. Actually, these emergency operations are included in emergency admission cases, but yes, I need to show this emergency
Okay,
admission before the slide of-
Prasanjit has joined us.
Yes, sir.
Yes, sir. I joined.
Prasanjit, please start.
अब बंद कर दूं। Good morning, our respected elders. I am Dr. Shishal and I am to present the presentation.
Start with the slides full set.
इसमें ऑफिस है.
You are not audible, Prasenjit.
Yes, sir. Share the screen.
Not at all audible. Not at all. Let Mehul start. So, yeah, sir. Let Mehul start. You see your audio connection. সাবের জন্য সিগন্যাল থাকবে না স্পিড কম করে সাবে সিগন্যাল নেই না সিগন্যাল বাদিকে ডান দিকে চেপে সাবেতে বাদিকে চেপে যেতে হবে ডান দিকে না এটা ঠিক আছে ডিভাইডার আছে
Prasanjit, you are not audible.
Let Mehul start.
Mehul presented once. Mehul, can you present your audit once more?
श्रीनिवास से बात की भैया आश्चर्य से बात बोलो इस पे
Sir, is I am audible?
There are two phones are simultaneously connected. That is why there is echo. Please disconnect with one phone.
Hello. Sir, is I audible? Hello. Sir, is I am audible?
Yes, sir, you are audible.
Yes, you are audible.
Total patient 10, total OPD
Speak
patient.
loudly, Prasenjit.
Total OPD days 9, total admission day 10, total OPD patient 1180, which includes old 557 and new 623. Total number of elective OT days 9, total time in OT, table 1 which lab to 32 hours and 30 minutes, table 2 open 40 hours and 30 minutes. Total number of minor admission 57, emergency admission at 21, elective operation 26, emergency operation 10, and mortality 1 and morbidity 1. Hepatobiliary and pancreatic spring surgery, we have chronic calculus cholecystitis patient for which we do laparoscopic cholecystectomy in 10 cases and open cholecystectomy in 1. GI and perianal cases in fistula in anovate fistulectomy for 2 cases and recurrent abrasive we did appendectomy for 1 cases. Elective admission continue in hernia and groin surgery in incisional and mental hernia. There are 1 cases for we do mesh hernioplasty. In inguinal hernia, we do 6. We have total 6 cases. We did instant tension-free mesh hernioplasty for that. In umbilical, in single cases, we did anatomical repair. In breast and endocrine, we have a case of fibroadenoma in around 5 centimeter to 5 dimension. We did excision under TIVA.
Sanjit, please continue. Prasanjit,
Yes, sir.
please continue.
Hello.
डिस्कनेक्ट हो जा रहा है.
You are not audible.
Sir, is that audible?
Yes, sir, you are audible now.
सब लोग लेट हो गए क्या? मैं पीछे बात करूं. Hello, sir.
Yes.
Yes, sir. From beginning, I am starting, sir, now. We have summary into total OPD 9, total admission 10, and total OPD patient 1180, which includes old 557 and new 623. Total number of elective OT is 9, total time in OT, total time in minor OT 10, and total number of mortality 1. Elective admission we have 57, emergency admission 21, elective operation 26, emergency operation 10, mortality 1 and morbidity 1. In hepatobiliary and pancreatic spleen surgery, we have chronic calculus cholecystectomy, in which we did 10 cases we did lap cholecystectomy, and in single cases we did open cholecystectomy. In GI and perianal cases, fistula and anofistulectomy done for 2 cases. In rectal appendicitis, we did open appendicectomy for 1 case. In hernia and vascular incisional ventral hernia, we did mesangioplasty for 1 case. In inguinal hernia, we license umbilical hernia, we did anatomical repair for 1 case. In breast and endocrine surgery, we have a single case of hyperadenoma in left breast with 5x5 dimension. We exercise that under TIVA. In miscellaneous cases, we have circumcision done for 5 cases and debridement of corneas gangrene done under TIVA and reversal of Hartmann procedure with the help of circular stapler. In emergency operation admission, we have acute appendicitis, perianal abscess, and diabetic foot ulcer. For acute appendicitis, we did open appendicectomy, and perianal abscess, we did IND under TIVA. And diabetic foot ulcer, debridement done under AA. These are the list of minor operation. And in morbidity and mortality, we have single cases. In morbidity of 45-year male patient who is a post-op case of reversal of Hartmann procedure on the pylori develops seroma, which is managed conservatively by dressing and swab stent for culture sensitivity. and it comes out positive for Klebsiella group of bacteria, which is sensitive for doxycycline and other antibiotic. After successful conservative management, we discharge the patient on POD7. In mortality we have single mortality case, 52-year male who presented with diabetic foot ulcer with feature of severe septic shock and more and unstable vital. Admitted, initial resuscitation was done. We secured the airway with intubation and put the patient in T2. Patient, but initial resuscitation get failed and patient is developed cardiac arrest within 4 hours of admission and patient is succumbed to death.
Sanjit, what is the primary surgery in the case of Hartmann's reversal?
Sir, it is presented in the month of September into the features of sigmoid volvulus. So we did sigmoid volvulus, we did colectomy with hello? We did exploratory laparotomy and distal colectomy, and colostomy was formed and hello. And it is then comes after 6 months we reverse that Hartmann. Hartmann procedure was done initially.
For sigmoid volvulus. That is
Yes, sir. Yes, sir.
Now
Is
you tell me
it-
end-to-end anastomosis.
Yes, sir.
End-to-end anastomosis you have done using circular stapler.
Yes, sir. With a 31 number circular stapler.
Okay. Sir, can we, should we, do you have any other questions or should we conclude to this?
Hey, I could not follow his mortality part.
President,
not
please
audible.
tell about the mortality once more.
The mortality part, a patient 52 years with the features of severe septic shock and with the comorbid with the diabetic foot ulcer is presented in our ER emergency. From there, it is admitted in our ward. But due to unavailability of CCU bed, we managed it in our ward. With and I intubated the patient and put the patient in T2, but it is not suffice. Ultimately, patient died in ward due to lack of ventilation and this.
Now, what is the time gap between the admission and death? Time gap?
4 hours. 4 hours.
4 hours. Okay.
Yes, sir.
Okay.
Patient in severe septic shock, sir. It's unstable with unstable vitals. BP is falling down. Is around MAP is below 60. It is around 50, and peripheral pulses are also feeble. So we try to resuscitate, but we are not able to that due to unavailability of CCU bed.
Okay. Thank you. Thank you.
Okay, sir.
The Mehul has presented earlier. Should I ask him to present again?
Mehul has already presented.
Yes, sir. He presented first.
No, no. All three are done.
Yes, sir.
Okay. Okay then. Okay. Actually, there was a network problem in Rajarat. I couldn't join. Okay.
Okay.
Thank you.
Thank you.
Okay, let's conclude with this audit. Thank you, everybody.
Thank you, sir.